I've spent a lot of time trying to educate you on infection prevention and infection treatment, as well as understanding all of the signs and symptoms that go along with that. But what happens when you get red, itchy, irritated, and it's not an infection? Let's take a deeper look at what it could be and how to address it. My name is Lisa Sylvestri. I'm a physical therapist and a certified lymphedema therapist, and my goal is to make us all lymph smart. Take a look at this picture. This is my patient 1 week after her recent LVA surgery. Now, at first glance, she told me this was red, itchy, getting worse, looked very much like a rash, and she was really worried that she had an infection. But I wasn't quite convinced that it was an infection because it was at every surgical incision where her surgical glue was. And what I'm noticing is that more and more of my patients are starting to get either a contact dermatitis or an allergic reaction to surgical glues, surgical tapes, and just any sort of tape, even a Band-Aid adhesive. So how do we know what the difference is and what do we do to take care of it? Well, when you have something that looks red and irritated, it looks bumpy like a rash, it's something that you can't keep your hands off of, the first thing I always suggest is take a pen or a marker and just mark around the red area. The first thing you want to look at is to see, is the redness expanding outside of the borders you've created? If yes, then you really probably do have an infection and need to get on an oral antibiotic or possibly something even stronger, depending on how fast and bad this redness is getting. But if the redness starts to subside or get smaller over a couple of days and localize again like this patient, but it remains itchy, it's possibly a little bit warm, and the only thing you want to do to make it feel better is scratch it, my guess is you're experiencing an allergic reaction to the adhesive or the glue itself. They look very similar. And what starts as a contact dermatitis or an irritation or inflammation of the skin itself can become infected if you do scratch and open the skin and some bacteria gets in. So you really do want to try and keep it as under control as possible. The best way to do that is to put a cool compress on the area. You probably don't want to put ice, especially on a surgical area right away. But again, always talk to your medical team, specifically the surgeon and the surgeon's team, if you are within the first couple of weeks of surgery, when this adhesive irritation is most likely to occur. If you need to keep it covered to prevent scratching, you may want to avoid a Band-Aid that already has a different type of adhesive on it, but perhaps a gauze with some paper tape or something else to prevent you from opening that area. Additionally, sometimes a little bit of compression over that area does help any localized inflammation disappear and improve a little bit faster. So if it does turn out that this is just a dermatitis or a skin irritation, you want to obviously change or remove any adhesive. If it's a surgical glue that is causing this, the only one who should be removing any glue is your surgeon or his or her own personal team. Do not try and pull glue off yourself. Your doctor may also recommend a different topical medication to reduce itch, to reduce inflammation, but don't try anything over the counter on your own until you speak with your medical team. Stick to the options I've already mentioned. They're easy, they're temporary, and you can look every day to monitor the skin to see if it's improving. Thanks for tuning in today. I hope to see you next time.